Welcome to Data Science Perspectives. This series focuses on analytics and data science professionals from across industry to learn about how their career unfolded, what skills they look for when hiring, and what trends they think are coming next. I'm your host, Bill Franks. Let's get to it. Welcome to this episode of Data Science Perspectives. I'm your host, Bill Franks. Today I'm going to be joined by Divyes Patel. I've got to know Divyes over my time at KSU, as he and his organization have been longtime research sponsors. In fact, they've enabled a good number of our master's and PhD students to get invaluable experience at working with real healthcare outcome data over the past few years. It's great to see the emphasis they put on healthcare outcomes, and you'll hear about some of that today. Divyes is currently the Director of Innovation Research and Development at a large healthcare payer in Tennessee. He's had 14 years with the company, and prior to his current role, he had several others over time. Before he came to his current employer, he spent 5 years with UnitedHealth Group and their analytics and research organization, and he also had early career roles with Cigna, NCO Financial Systems, and Hewlett-Packard. He's got undergraduate degrees in both chemistry and engineering from the University of Tennessee at Chattanooga. And with that, let's welcome Divyes to the show. Thanks for joining me on the show, Divyes.
Yeah, thanks, Bill. Looking forward to it.
Yeah, what I like to start out with everybody is just to find out a little bit in your personal journey, what initially drew you into the world of data science and analytics?
Yeah, sure. So this is going back several years, but so I graduated University of Tennessee in 1998 with degrees in chemistry and economics. I was kind of trying to figure out what to do, from a career perspective. Do I get my master's or where do I really need to go? If you look at the late 90s, remember the Y2K, big thing, everything was supposed to, all these systems were supposed to shut down. And back then there was a big need for COBOL programmers. There was a big deficit. And they were paying good money. So I actually landed a job working for the state of Georgia on their Medicaid program because they were doing a big conversion, a Y2K conversion on COBOL. I had no programming experience, but because they could not find people, they had a training program. So it was a great way of getting into IT at that point. Learning COBOL back then. So I stayed there probably 2-3 years on the COBOL side, kind of retrofitting their systems to be Y2K compliant. After that, I got a position with another company. It was on the provider side doing billing, but I was kind of introduced onto the reporting side. So, doing a lot of their kind of ad hoc reporting. That kind of led me into the more of the reporting analytics kind of space. So working on Crystal reports, I became a report writer back then. And then just from family obligations and stuff, I actually moved to Chattanooga where I worked for Cigna. And that's where I had my first foray into data analytics and reporting and data science. So I was a part of a team that was really heavily doing kind of reporting and analytics for our large employer groups. So these were in-depth studies of their cost analysis. So that really got my passion growing about, how do we really, not just on the technical side on pulling all the data and all the different disparate data sources we have to deal with, but really, how do you build the solutions? What is a story we're willing to tell, right, to employer groups to save money or, how to best serve the members, right? So I kind of started there in report writing, and then my career kind of just grew. I kind of moved to United. I led some data warehouse kind of development there. I led some reporting and analytics teams. I led a team that was building out the entire ROI kind of infrastructure and SaaS for them. And then I worked for a large healthcare payer where I've been for the last 14 years, and I've led multiple roles in there. So I built a clinical data warehouse on the Teradata platform. I have led reporting analytics teams. I'm leading AI and data science teams right now on the innovation side. So really working on proof of concepts and pilots right now about really how we can not just enable from a technology perspective, but how we can reimagine processes for our business right now. Yeah, so it's been a journey going on 25 years now in healthcare.
It's interesting. Two things you mentioned really jump out at me. One, you mentioned that you're starting with some COBOL. I actually know a fresh college grad who's working for a company and they're teaching him COBOL because they
Yeah,
still have some legacy systems they need to maintain and or update,
yeah,
and they need more COBOL. So I couldn't believe in 2025 there's a job in COBOL. But that, and
yeah.
then Crystal Reports. Haven't heard of Crystal Reports in a long time. That was a big player back in the day.
Yeah, back in the day, yeah, that was it, right? So back in the, I think it was early 2000, right? I was a Crystal Report writer, right?
Yeah.
So we started Crystal Reports and then moved on to SAS. So SAS was the big player, especially on the data wrangling and the statistical side of things. So yeah, been a SAS
It,
program for 20 years now. Yeah,
it's funny how some of these names that are so big for a while and then you don't hear them, and
yeah,
I hadn't thought about Crystal Reports in so long. But
yeah.
anyway, what about, you've ended up spending a good chunk of time in the healthcare space with a couple of different companies. So what is it that has led you to focus on that for such a large portion of your career? What kind of drives your interest?
I think with healthcare, so if you look at just healthcare overall from from our from the U.S. GDP perspective, healthcare costs just continue to rise, right? So what kind of drives me is, how can we help solve, or how do we help kind of, cost mitigate? What are strategies we can do for cost mitigation? And when you look back at it, it's really on the data analysis side. I think what people don't realize about healthcare, how disparate the data sources are, right? So, there's a saying on the hospital and physician side, if you've seen one EMR system, you've seen one EMR system, right? So each one, we have thousands of EMR partners we partner with. The data we get from them is very, very unique to them, right? So, and just internally as a payer, a lot of our data, I'll probably say 80, 90% of our data is still kind of unstructured, right? We're still using fax machines, right? From providers still come in. So how do you coalesce a lot of that information? There's still challenges. So, and it's still amazing to me, like, I think healthcare is now maybe 15 to 20% of our GDP, right? And if you really, like I said, right, we're still getting faxes, right? A technology that's over 60, 70 years old, right? In order to get things. So I think just being part of this, right, and being on the journey of how we can really, from an interoperability perspective with data, from a data science perspective, from building algorithms that can really make the healthcare journey right for us as patients and members, right? So I think there's a lot of opportunity still to go. We've made a lot of progress in the last 10, 15, 20 years, but I think there's so much opportunity that we can do, right? Especially for something that is on everyone's minds.
Well, let's dig into that. When you talk about the opportunity, I know just from my working with both your organization and some others, there have been so many new sources of data that have become available in the healthcare space over the past let's say decade or so. That's probably almost overwhelming. But what's one or two of the types of data that have become available for use in healthcare that you're most excited about from an analytical perspective? Is it some of the sensor data? Is it clinical data? Like what has been the some of the biggest breakthroughs?
Yeah, I think so. Like I said, going back to the MR, building an interoperability system to get the clinical data, because us as a payer, we get the claims information. So if you really think from a claim, it's just the billing information. So I had this procedure code done, right? I had these kind of labs done, right? We get that picture. From the clinical side, and this is where the most valuable data is in the notes, right? So the physician notes. So, hey, Bill went to the physician. Well, we see on the billing side that he had these procedures done, but the context really is in the clinical notes, right? So I think bringing that data in, and then marrying it to the structured information that we have to get that holistic view, right? Which is still a work in progress. So I think getting that data in, and that's getting better and better, right? As we start to get more kind of EMR connections in, we get better and better pictures. The other source of data that I'm really excited about, and this is still a working progress, is around SDOH, so social determinants of health. So, for example, on our Medicaid, right, or the Medicaid line of business, so these are the poor, these are people that kind of qualified for assistance through whatever state program that they had to cover their health insurance. Well, a lot of times when we talk to these members, right, these members have trouble, paying their bills. They need housing help. They need help with their children. So, and so what we're seeing now, what a big benefit is that we can identify all day long, you know, you know, what these members need, right, from an SDOH perspective, right? Do they need help with housing? Do they need help with food? They need help with nutrition. They need help with transportation. But how do we kind of close the loop, right? So how do we partner with charities? How do we partner with not for profit institutes? Get these get our members there, but then also close the loop, right? So we know that this person had this SDOH need kind of need met, right, and get that data back so we can close the actual loop and then see what's working and not working, right? So what are the not-for-profits that are doing a better job, right? Where do we need to kind of invest in? What, especially around COVID, it was, what, like we were looking at, where do people get their vaccinations? Are there kind of actual areas that had more comorbidity? So we did a big analysis in the state of Tennessee as part of that. And so that really helped in terms of targeting, where we need to put kind of outreach kind of efforts in. And that's still ongoing. So I think bringing in not just the provider data and the payer data, but these non-traditional data sources, right, that can really kind of, you know, build that complete picture of what's really going on in a person's life, right? Because at the end of the day, we got to solve all these issues, right? If you really want people to take care of their health. So it's been common, like for example, we keep telling people, why aren't you getting your preventive measures done, right? Why aren't you getting your screenings done? Which is, well, should I pay my bill for my house, right? Or should I get my, where do I send my kids to school, right? It's the priorities wise, right? So if we can help solve those kind of things, I think people will start taking care of themselves better.
I like your point about trying to read in the doctor's notes as opposed to just the things, because I know when I'm at the doctor, they've
Yeah,
got their little system and they have to click and click and click and they have to pick from certain categories. And I can only imagine, let's say I'm in with a sprained ankle, the freeform note of, yeah, it wasn't as swollen as it might have been, as I've seen some, but I definitely think there could be a tear there.
right,
Adds a lot of color on the generic
right,
diagnosis codes
exactly.
that are given. So I can see how with the large language models being where they are today, that there can be a wealth of info you can get out of those notes.
Yeah, yeah, yeah,
So tied to that, then it brings up AI. I know, when you and I have chatted, obviously in your role as having innovation as a big part of it, AI is something that you've started to focus on much more heavily in recent times. So in the healthcare space, are there some specific areas? I mean, I guess I just tossed out one, but what are some of the areas you're most excited about AI potentially having an impact in the near term for healthcare?
yeah. I think your example is great. So, we're actually taking it a step further. So, yeah, you can use a large language model to kind of read, what the notes are. But if you really think from a transcription perspective, right? So, like you said, you have nurses that are actually typing in, right, what the doctor, as they're kind of working with their patients. But there are POCs that are going on right now where instead of actually typing in the actual kind of diagnosis or procedure goes or the administrative burden, can you just have a live transcription right on your phone that's happening it? And then a large language model is standardizing what that actual transcription is and then pre-populating, your computer systems as they're going through, right? So that means that your nurses or whoever is working with the patients, right? They're spending more times on like treating the patient, right, and kind of understanding their needs versus doing all the administrative tasks. On the payer side as well, so we have a POC going on right now. So we have what we call care coordinators that go out in the field, talk to our members, right? These are members that are too sick to kind of leave the home, and we're actively kind of working with them. Same thing, there's regulatory requirements that we have to go through different forms and kind of document what's going on, but it's taken away from the actual member and care coordinator experience. So how can you use AI to really automate that right process, right? And how do we kind of standardize that? So I think things like that really can help us from an AI perspective. I think the other big thing on AI is just productivity gains. So we have another kind of pilot around our customer service, right? So if you think, if you have a billing question or something that you call into a payer for, right? Just the workflow that a payer, like a customer service has to do, right? They need to look at your benefits. They need to look at terminology. They need to look at all the rules and regulations. So how do you build a co-pilot that can take all that information, right? And so instead of them manually going through like 20 different data sources, can you build them a co-pilot where they can ask that question and it's basically gathering all the necessary information and giving a concise kind of picture of what that needs to be. So we have active kind of POCs around that. But in terms of process automation, productivity, kind of gains around that, I'm really excited because I think there's a huge opportunity for AI just in that.
That's awesome. Even as you've done some of this work and this research, obviously you've always been a big supporter of universities, and I know not just us at KSU. You work with other universities. So, what is it that motivates you and your organization to do work with universities, and what do you all get out of it? I think we know what the students and the faculty get out of it in terms of getting some real experience with real data, but obviously you all must be getting something from it, or you wouldn't be so dedicated to it.
Yeah, yeah. I think there's a couple major things, right? Obviously, it's talent pipeline, right? So, what's going to be a next generation of data science and analytical leaders, right? So, getting people in, right, through the lab with KSU, right, or getting them out of college, right, as an entry level position. So, I think these partnerships are great about build of cultivating that kind of talent, right? And getting them into our organization and letting them kind of grow. We've hired, as part of the lab, but we also hired a lot of KSU graduates as well. Um, I think the other kind of big aspects of this and what we've seen as well with new grads as well as part of the lab is just the perspective that kind of students kind of bring, right? Because like I said, I've been in healthcare now going on 25 plus years, right? And a lot of my coworkers and peers as well, right? They've been in the industry so long. So it's sometimes refreshing when you have a college grad that comes in and says, "Well, here's a project, and this is what we're trying to do," and they have a completely different picture of it, right? They have a completely different perspective, right? And sometimes you know, especially on some of the grads that are that have come from KSU and have been on my team, and I says, "Yeah, some of that is actually good ideas, right? Why didn't we think of it? Because we get so tunnel vision sometimes in what we do, right? So bringing in someone new with a completely fresh perspective who has no biases, right, of working in the industry. Obviously, there's a balance, right? And we can explain, well, you can do that, you cannot do that. But I really like that fresh perspective because it makes us kind of, take a fresh look at ourselves, right? Why are we doing this in the first place, right?
Well, that's a good perspective. What about as you look at your career, and you've obviously continued to progress as time has passed. What's one or two of the traits that you think have most helped you succeed in your career?
Yeah. So I really started out more on the technical side, right? So how do I build reporting solutions? How do I become a great SaaS programmer? I think what really took me to the next level was like not just building the technical solution, but it was how to apply it to the business, right? So understanding the business perspective of it. Sometimes I think we get lost of just building the best kind of technical kind of product, but really it is how does this really benefit to the business, right? And especially from the reporting data science perspective, you can build the best algorithm all day long, right? But it is really how do you kind of ingest that into a workflow? How is the business really going to kind of benefit from that, right? So building that whole holistic kind of view, right? So not just building a solution, a technical solution, right, or a data science solution for the sake of it, but it is how do you take it to the finish line, right? This is embedded into a workflow. This is people are using this to make different decisions, right, or better decisions, and I'm tracking that, right? So I think, especially in my role in innovation right now, it's you got large language models, or you have AI, you have all these different kind of solutions out there, but I think what really kind of helps just not myself, but my team as well, it is how do you really apply it to the business, right? So we take it from the business lens, right? We're taking these solutions and how is this really impacting them, and how do you really make it, make their lives better?
That's good. It's interesting how uh, so many people in school, and this is part of why I love putting students to work with companies like yours in school with that focus on the technical aspects of everything. I think a lot of students, you know, benefit from hearing that perspective that you've got to do more than just know those formulas. You've got to be able to apply it and explain it and so forth. And
Yeah.
it's such a recurring theme when I talk to people on this webcast
Yeah.
that they mention that. So hopefully, any students or young career people listening will take heed of that advice, because it's definitely good. Um, so obviously, what you do every day has evolved over time as well, as you've changed roles. If you look at today, and you wake up in the morning, check out your calendar, and see what's on the schedule, what is it that motivates you most? What's on the calendar on a day that you're excited to get up and get started?
I think some most favorite types of meetings is when my team have built something, a POC, and then we get to demonstrate it to, we have a meeting with the business to kind of show them the capability. So we work hand in hand, right, with our business stakeholders. But those types of the meetings where they go, aha, and then, they have light bulbs going off. We have light bulbs going off. We're like, this could be a game changer, right? So we had one this week as well, right, with our customer service team about, how do we kind of help reimagine the CSR, the customer service representative kind of workflow. So those are the types of meetings that really kind of get us motivated, right? Because now, we spend so much time building something, but now we see, this could be a complete game changer, right, for our business, right? That can really have a huge impact. Those are the kind of meetings that are kind of, my, my day is kind of spent like 80% in meetings, right now. But those meetings I kind of really look forward to. Yeah.
Yeah. So I just out of curiosity, obviously, a lot of those meetings go really well. Some of the meetings go not so well, either because your POC wasn't as successful as you
Yeah.
hoped,
Yeah.
or somehow the business doesn't get it. So how do
Yeah.
you um, how do you manage the relationship then on an ongoing basis? If you have one that just doesn't go over well, how do you regroup your team and get past that?
Yeah, yeah. I think initially when it's going back a few years when we first did it, right? I think my team took it kind of hard, right? Oh man, I spent all this time, effort. But I think it's instilling we call it kind of a fail fast kind of mentality, right? So I think getting business buy-in upfront, right? Being more iterative with them, right? So like not just spend 4 months in a vacuum and try and develop something, but have them along for the ride. So if you know that something is not working or it's not going to pan out, we know sooner rather than later, right? And then I think, especially in our team culture, we've kind of adopted that fail fast kind of mentality, right? It is actually good to fail, right? So you have learnings as long as you learn from it, right? So I think, instilling that in our team, right, in our kind of organizational culture of a fail fast kind of mentality, because you are going to fail. I mean, I probably say most of the time you are, right? You're not going down the right path, but be able to take that learning, right, and pivot and do something, right, more productive. So, failing is not a bad thing, right? Failing is a good thing as long as you learn from it.
I guess that's where it's important to have that good relationship with your business partner as well, so that they
Yeah.
have the understanding, hey, we're really going to push the envelope on a few things, and so they might not all work, so that that business sponsor doesn't have the impression that you're
Right.
somehow superheroes who will win all the time. And if they
Yeah.
understand that too, to your point,
Yeah.
it's much easier to get past those failures when everybody understands that's part of the process, versus, I
Exactly.
think some people make the mistake of trying to overcommit in to get people to buy in, but you've set yourself up for big trouble then on those cases
Yeah.
where it doesn't work out.
Exactly. Exactly.
So what would you say to either a student or someone pretty young in their career? What advice would you have for them as they look at what they should be doing in the next 3, 5, 10 years to advance their own position?
I think the number one thing, especially if you're in school right now, is if there's an opportunity with the lab, right, with KSU lab or, different kind of opportunities like that, or getting an internship, because I think getting that practical kind of experience, depending on whatever industry that you want to get to, or if you don't really know, right, trying to, is it healthcare, is it finance, or what have you, but getting that kind of perspective, because especially just working with the lab, right, the students that we've had over several years, right, I think once they get in, all the aha moments, right, data is very different, right, than what you see in the classroom, right? It's not, you don't have a nice clean data set to work with, right? You have thousands of tables, you have disparate data sources out there, right? How do you coalesce all that information? There's no, there's no perfect data dictionary as well, right? So it's kind of like, how do I kind of do this? How do I experiment? How do I profile data? So those kind of skill sets, which, I'm not saying the schools don't teach them, but you can get with practical experience, right? Which you can get, like, from a peer mentorship, or like this, we have to do this or we have to do that, right? So things that are not kind of related to building a statistical model, but just kind of, the grunt work of getting data, right? Massaging the data, wrangling the data. I think getting practical experience of that, because a lot of times still, right, you've probably seen all these images, right, where the analytics, like you have a big mountain, the analytics is just a peak. The core of it, right, is that data wrangling kind of perspective. And to be honest, with LLMs now, with tackling kind of unstructured data, right, that is just getting wider and wider, right, because the data sources are getting more expensive as well. So yeah.
When you mentioned you know, assessing the models having to have the practical experience, it's funny. I just had again last week in my capstone class, one of the questions was, and this is a real applied data set, right? So this isn't a academic thing in the book. I've never seen the data set myself. So what's the level of accuracy that's acceptable in these models for the purpose of this project? And I always have to explain, well, one, I have no idea because, we haven't done this project before. But two, in the real world, you take what you can get and decide if it's good enough. But the idea that it's going to be, 90, 95% like in a textbook is not going to be there. So I always have to remind them, don't get discouraged if you're having what you think are horrible accuracy numbers. I always say the goal is to beat random or beat no
Yeah.
model.
Yeah.
And if you're doing that, that's a winner in many cases. So it's funny how uh, getting hands on real data, I think, hammers those lessons home real fast.
Yes, exactly. Yeah. Yeah, but it's
So
kind of hidden truth around data science, right? Like how much, like even the students that we work with, right? How much time they're actually just learning data, right? Joining data together, right? So basic kind of principles around that. So yeah.
Well, I've taken a chunk of your time. Let's one quick wrap up. If you were to look forward 3 to 5 years and seeing, hopefully, especially in your role as with innovation, probably you think about this all the time. What's one trend that you think is really going to have a major impact on the world of analytics, data science, and now AI over the next 3 to 5 years?
Yeah, I think, we touched on this, right? The advent of LLMs, right? So I think not just building point solutions, because we're seeing that in the market, right? But building true agentic kind of systems, right? So, that are bringing together multiple kind of RAG systems or multiple AI systems together, right? To kind of really build those kind of augmented kind of systems for humans. I think that's going to be something that's a work in progress right now, but I'm really excited about how that can really help, or how that can really evolve. I think what's kind of interesting, if you look back at 2023, 2024, the whole generative AI, it was such a peak, and what we're seeing right now, especially late last year, is what we call the trough of disillusionment, right? Is like, yeah, this is great, but what is the actual practical purpose? And I think we're at the point right now is, yeah, this is valuable, but it's really is, how do you put it all together? How do you stitch all of this together, right? And really kind of make it, how do you really reimagine processes with this new technology? So I'm really interested to see how that kind of evolves, and how our lives as data science and data analytics professionals kind of evolves with that.
I'll tell you, I haven't figured it out myself yet. I just know it's
Mhm.
going to be really interesting. And I think
Yes.
that even if you and I tried to sit and say how it's going to affect us, we might get a few things right, but there's a few things that we're not even seeing coming yet.
Exactly. Yeah. Yeah. That's one other thing. Like if you look at all the hyperscalers, we work with Microsoft and Google right now. I mean, they're coming up with new technologies, new models. I think every month or every other month now, right? So it's exciting. It's a very exciting time to be part of data science and data analytics right now.
I think that's a great night to end, a note to end on there. So thanks so much for spending your time with me today.
Okay, no worries. Thanks, Bill.